But what I have found in the area of sports gynecology and health and sport in the women is that's what a lot of doctors are, and that's what a lot of athletes are. They're lost, confused, unsure and unclear. And I hope with today's talk we can try and sort of clear some of these issues that are important, because menstrual health and sport, I think, are very closely linked, and there's a lot that can be done to help people, and therefore not only help obtain and obtain peak performance, but also help maintain it if there are issues about women's health. Just briefly a bit about me. As you say, I'm a gynecologist, Barbara, my wife, and 3 children, my professional work is based mainly in London, but also I have a clinic down in Dorset. How did I get interested in sport? Really, in my youth, I used to ride a lot of horses, and then when I qualified, I got involved as doctor to the equestrian teams, and then became Director of Sports Science and Medicine for the British Equestrian Federation for 10 years, and went to several Olympic Games, Sydney and Atlanta, and 2 World Championships and about 15 European Championships. So an interest in gynecology, an interest in sport linked together, and that's how I suppose I've developed the expertise in sports gynecology. So what I thought would just be worth starting off with is trying to get a basic understanding of the menstrual cycle. Because if we can understand the menstrual cycle, then we may be able to understand what causes pain with their periods, what causes premenstrual syndrome, and how we can use our understanding of the menstrual cycle in order to help people delay their periods if they want to for competition, etc. So understanding what happens with the menstrual cycle, I think, is key, and it makes it clear to understand. And also, by me being told when a patient comes into me and says they have a regular period, it instantly says to me a lot of hormones are working well. And Anne Frank, the diarist, said in her diary once, "I don't like them, but they're my inner secret." And I think that's useful because it does allow me to say, yeah, when somebody is having regular periods, things are working. If you're not having periods for certain reasons, it doesn't mean things aren't working, but you've just got to look a little bit further. And how does the period start? It starts by hormones produced at the base of the brain by the hypothalamus, which then talks to another hormone, the pituitary at the brain, and that then talks to the ovary. And it produces estrogen in the first half of the cycle. We haven't got a pointer anywhere, have we, or a pen? No. In the first half of the cycle, the estrogen is produced, and then after ovulation, you get estrogen and progesterone. Is that a pen? That probably is useful. So here you get the first half of the cycle, you get the estrogen being produced, then you ovulate, which is the egg being released, and that's your most fertile time, mid-cycle, and then you produce progesterone and estrogen. So what happens to the lining of the womb, and this is important when you're worrying about some of the problems with periods, the lining of the womb with the estrogen grows, and then with ovulation, mid-cycle, it stops growing, and it becomes what we call secretory, and then when you don't fall pregnant, the period sheds. So how I compare it a lot, and I'll use this several times throughout the talk, is a bit like grass. The hormones are the sun and the rain. The grass grows in the middle of the month, up to the middle of the month, then it stops growing and then is cut once a month. And it's that's happening, and what makes it cut is the hormone progesterone. And I'm going to come back to that on several occasions, because when progesterone is produced, it stops you bleeding. And when you stop producing progesterone, you have a period. So what happens here is that you release the egg, you produce progesterone. Progesterone then prepares the lining of the womb for the baby to come in because it's wanting you to get pregnant. If you don't get pregnant, you stop producing progesterone and you have a period. But if you do get pregnant, You keep producing progesterone, and therefore you don't have a period. And that's how we can use progesterone later on. If you want to delay your period, we can try and mimic the body into thinking it was pregnant, and therefore you don't have a period. So that's the basic menstrual cycle. And it's therefore finely tuned between the hypothalamus, the pituitary, the ovary, the uterus. And it's like a finely tuned Formula One car. And little changes, therefore, can upset it and cause problems like irregular periods, too frequent periods, too heavy periods. So what sort of changes can cause it? And do you know the story about the frog? The adaptation of the frog? If you like frogs, please leave. But I think this is very true. If you get a frog, I haven't done this experiment. If you get a frog and you put it in water, the frog swims around. You then heat the water and the frog adapts to the changes. It changes its respiratory rate, it changes its cardiac pulses, and it changes its pores, and it changes to the temperature. You gradually increase the temperature and the frog keeps on changing, keeps on adapting to that temperature change until it gets too hot and the frog dies. If you get a frog and you put it into the water, the temperature at which the first frog died, it jumps out. So the moral of that story is we're all very good at adapting to little changes in our body, not realizing those eventually could kill us or cause major problems. And that's the same with the menstruation, that we've got to look for little adaptations which we can easily sort out. But if we leave it too long, it may cause big problems to your health and to your profession as a sportswoman. And therefore, let's just look at how this can affect women's health. Well, puberty is interesting. The average age of getting your first period is about the age of 11, 12. But we do know that puberty can change according to different things. It can change, and probably the most important thing is body fat. And I'm going to keep on coming back to that, and therefore that's why I tie very much into Kevin's talk. Body fat is a hormone in its own right, and it's important. And we do know that in order to get your first period, you need to, we used to say it used to be a body weight of 49 kilograms, but that's probably a bit crude. But it's probably body fat of about 22%. So we know, and you keep on thinking, this body fat of about 22% is key to allowing this whole mechanism of these hormones to work. So we know if you're low body fat, low body weight, which can be therefore associated with high levels of physical training, dietary behaviour, can cause you to delay your period. Also stress can, and stress can probably affect body weight, etc. So they're all very much intertwined, and that's why it's this frog story, all little adaptations. And also there may be people who are tall and thin, who may be, because now we're talking about sport, may be delaying their period, and therefore, but equally may be going to that sport that attracts tall and thin people. Because why do I say that? Because it's quite interesting when you look at sportswomen, the age at which they get their first period is different to what professional sport they go into. That the average age here was about 12 and a half, but ballerinas much, much later, around 15, and then you can see runners about 14, volleyball, etc. So various different changes according to sport. So the sort of take-home message here is instantly, even before you start having periods, there can be an effect on when you start your period according to what type you are, what type your body fat you are, and this may therefore have an effect at a later stage in your life. But equally, it may be that the tall, thin girl who has low body fat is going to be picked to be the ballerina and not going to be picked to be the wrestler. So it may be the pre-selection of that type. So it's not quite clear. But equally, that moves on. So now we're talking about the role of body fat, how it can affect starting your periods, and it can also affect later on, and it can affect your hormones. And this is a slightly complicated slide, But what we do know is the cells that are in fat tissue do produce a hormone called leptin, and leptin affects the hypothalamus, affects the pituitary, affects the ovary. So the leptin can affect, and that can have an effect on your hormones. And how does that, or what does that start doing? Let's just go back to the menstrual cycle. And if you think there are two parts of the menstrual cycle, there's lots of estrogen, and if you're ovulating normally, lots of progesterone. So in order to have a normal menstrual cycle, you have your normal amount of estrogen and a normal amount of progesterone. As things begin to change, and this goes back to the adaptation, and that's why I'm talking about this, because if you begin to see changes, it's worth just talking about it. It may do nothing, but it's worth just talking about it. What gradually happens is the next part is you can have normal amount of estrogen, and you have an upset and a less amount of progesterone, the second half of the cycle, being produced. And what can that cause? That can cause early bleeding, that can cause irregular bleeding, and if one's trying to conceive, it can cause infertility. All reversible. Don't forget, this is all reversible. It's not permanent in any way. Then gradually what happens, you have normal amount of estrogen, but no progesterone, no ovulation at all. So if you go back to my grass story, what happens there, if you remember, menstrual cycle, the grass grows with estrogen, and then with progesterone it stops growing and it's shed. If you're just producing estrogen, the grass just grows and grows and grows and grows and grows, and then eventually you have a heavy period, it just falls over, and it's an irregular period. So a late, heavy period is often due to the fact the woman isn't ovulating, isn't producing progesterone, and is having the effect of that. And then gradually what happens, you move on, next step, less estrogen, no progesterone, and eventually no progesterone and no estrogen and no periods. So going back to my frog, there's a gradual change in the periods, and picking up at early, one can try and stop that little adaptation and get it back to normal. But you may say to me, well, so what? Does it matter if I don't have periods? And I think this is where it's, and that's why I love coming here. Yes, I'm a gynecologist, and we all, but looking after sports people and sports women, in my opinion, is an integrated approach. It's not a gynecologist, trainer, sports physician, sports psychologist. We all need to work together, because I'm saying, yes, I think being a gynecologist, it is better to have regular periods or manage your periods. But some people may feel that it upsets your performance, and that's why you've got to have this dialogue between, does having no periods have an effect on your performance, and does having no periods have an adverse effect on your bone function? So what would be my concerns about low estrogen? By not having enough estrogen in your body, it can increase the risk of thinning of your bones, and therefore have an increased risk of stress fractures, which are not, and stress fractures are not all due to thinning of the bones, but it can have an effect on your performance by causing injury. But also, not worried about your performance, but more worried when you're 60, 70, 80 years of age, it can make you have a much, much greater risk of getting a fracture then, because we do know your bone density is peak at the age of 30. Once you get to 30, that's it. From then on, you start losing bone. That's anybody. And therefore, it's like money into the bank up to 30, money out of the bank after 30. So if you haven't put enough money into the bank at 30, you run into debt quicker than the more. So you want to get more money into the bank before 30. Get your peak bone mass by 30 is important. So if you're not getting peak bone mass at 30, may not affect your performance, but may cause problems later on. And that's, I mean, a lot of this is not totally research, and a lot of it is just using evidence from other areas. And it used to be called the female athlete's triad. And the female athlete's triad is associated with no periods, excessive amount of exercise or poor diet, and lack of periods. but now, allowing Kevin told me today why it was, I didn't realise, it's now called REDS, which is Reduced Energy Deficiency Sport. So therefore, because it may also affecting men, and that's what we don't know, whether excessive amount of exercise for men could have an effect on their hormones. I think it does, but we haven't got as much evidence. So low body fat can affect your periods, does it gradually, and if you begin to lose your periods, it can have a negative effect on your body now and long term. And what do we know, therefore? What so what? This is the incidence of lack of periods in runners versus swimmers. And it's interesting, swimmers, this isn't such a problem. And it may be because they have more body fat. But it does show that, as you can see, as you increase the amount of mileage you run per week, so that's 20, 40, 60, 80, there's an increased risk of amenorrhea, lack of periods, as one does more mileage. And what does that have an effect on your long-term health? That this is here, this is people who have no periods, and this is people who have periods. If you have regular periods, you have a lower incidence of having stress fracture. And therefore, by not having periods, a higher incidence of stress fracture, which could affect your profession and your whole area of performance. So upsetting your periods can have a negative effect on your well-being, both now and long term.